I hope everyone is having a wonderful day. We are actually here to discuss Tessa's IEP. I want to go around the room just to introduce everybody. My name is Sarah Steyer. I am the special education teacher here at Tessa's school. We have Laura Root, who is Tessa's general education teacher, and also a behavior specialist. And then obviously Mrs. Troubled, she's here as well. Basically, we're just going to go through her IEP. We actually have developed a BIP for Tessa as well that we just want to go over just to make sure that everything is working correctly with Tessa and that she's able to function more appropriately during the school setting. For her IEP, basically I'm going to go through each section and tell you what the teachers have noted about Tessa.
Now that everyone's been introduced, I want to make sure that the parent rights have been introduced to the parents, and if you have any questions, they're about 12 pages long, so I won't read them word for word, but if you want to flip through real quick and ask any questions, or you can give me a call at the phone number posted on the very first page, and I'll answer any questions that you might have about your rights or Tessa's rights, okay? Thank you.
I'm going to go through each section and tell you what the teachers have noted about Tessa. Either behaviors throughout school, in individual classes, pretty much anything that the teachers have felt that is important with Tessa, we have included it in her IEP. The first section that we are actually going to start with is her, the strengths of Tessa. I'm not going to read all of it word for word. Pretty much I'll summarize the majority of it, especially with the testing as well. But we will start with the strengths. It says in her reading class that she seems to comprehend what she's reading, which is according to her the Wechsler Individual Achievement Test. She seems to do well with spelling and written expression, and then based on her Wechsler assessment, it says that she needs assessment, but she needs to be able to show that she's capable to do it while she's in school. In her math class, it said that she seems to understand mathematical reasonings very well, again, according to the Wechsler exam. She does well with numerical operations. She's also very skillfully answered items on the computer. That's from her math teacher. In her English class, it says she attempts to do the work in her class. She may not complete it accurately, but she does attempt the work that is given to her. Basically, as evidenced by her teacher's observation, Tessa tends to give more effort and participation in classroom tasks during her English class. She was observed not completing a given task in English correctly, but gave more effort and interest compared to her typical behavior that she's been observed in all of her other classes. Anything that you needed to add or that you would want to add to the strengths of the child by chance at all?
One thing the general education teachers have concluded is that Tessa would much rather work independently, and her accuracy level is actually higher when working independently. But one of our goals is to get her in the group setting, even though she's uncomfortable with it.
All right, for her preferences and her interests, it basically says that she prefers to work alone. A lot of her teachers have noted that she would prefer to work alone, and that Tessa sometimes will refuse to work in the teacher-assigned peer groups. In her geography class, it shows she's very little attention to the instructor in her lectures. She doesn't tend to want to participate in class. She's always requesting to move away from the group. On 2 different occasions, she's actually asked that. We've obviously had to deny that request, which then causes Tessa to refuse to complete her assignment, which we're trying to avoid as of right now.
As the behavior teacher, one of my biggest concerns is the fact that Tessa is avoiding any peer interaction in the classroom, which means she's probably avoiding it outside of the classroom as well. As a 10th grader, they should be interacting, talking, planning. It doesn't have to be about school. It can be about what they want to do on the weekend, but she does need to be having some type of interaction, and she's going at all costs to avoid any interaction. So I do recommend that she see a counselor to work on her insecurities, any fears she may have of being in a group, of you know, consulting with other kids, talking with other kids, interacting. I know there's obviously some fears there that she needs to get control over, and I do feel like the behavior counts.
On her most recent evaluations, Tessa did actually take a behavior assessment that basically diagnosed her as having clinically significant issues in internalizing problems and behavior symptoms, which obviously shows that she needs help with anxiety, depression, and withdrawal, which we already knew that based off of what her teachers and what you obviously said, Mrs. Trouble. It says basically that according to her Wechsler, she's actually on grade level, and her IQ is on range for the intellectual area. So she's basically where she should be, and that her strengths are in reading, math, and language. But her scores in school are not showing that she is doing this. But we all know very well that Tessa is very capable of showing the work in her school, and that her weakest area is internalizing problems. Under Tessa's academic needs, it basically says that Tessa needs to work on becoming more involved with her classroom discussions and activities, and that she would benefit from gaining control in her classes and being able to concentrate to pass her coursework. It says that we need to possibly, as teachers, need to spend more time to encourage Tessa to become more involved in her activities, and that she would benefit from intensive classroom support and possibly even after-school tutoring, just to make sure that she's able to catch up on her assignments as well. We also feel that she does need to seek professional counseling to make sure that she's dealing with her issues at home and at school, and that she needs to meet with the vocational rehab services to complete a series of tests to develop a career goal or goals to see what she's interested in. We also have to develop a BIP, a behavioral intervention plan, to make sure that Tessa can stay focused throughout her school day, and that we need to include a reward system to help reward Tessa for staying on task during her classroom instruction. She will be requiring a special bus, not really a special bus, but a special type of assistance on the bus for transportation, and that she'll be able to function on a normal school bus, but may need some assistance. We have her having an assigned seat during transportation to and from school, and maybe an additional adult support, just to help monitor her behaviors and to make sure that she doesn't harm herself or others.
One of the main services that will be put into place to help Tessa grow in her academics will be her behavior intervention plan. If we can teach her the skills to cope with the feelings and the behaviors that she's having, that'll give her more active engagement time during class, which will automatically, allow her academics to rise and her grades to rise, her interest in socializing to rise. All these skills that we're going to be providing her through her behavior intervention plan will be the basis of her making better choices and advancing.
All right, we're going to go into the special education factors. Basically, it's a checked yes or no response to Tessa's IEP. The first question basically asks if she has any behavior that impedes his or her learning or the learning of others. We clicked obviously yes because of her behavior issues that she's having. And does it have a BIP addressed? Yes, we clicked, of course. We are going to initiate a BIP. For limited English proficiency, for use of Braille, communication needs, assistive technology, required special PE, we clicked no. We feel that Tessa won't be on the Alabama alternate assessment. She's too bright for that. And then that transition services would be addressed in this IEP with an annual goal. Tessa will be able to use a regular bus. Basically with Tessa, we will be presenting her with a regular bus, but we will have that she have adult support, preferential seating, and her behavior plan will obviously be in place. We have that the bus driver and the support personnel will be aware of Tessa's behavior and her medical conditions that she had. For support, it says that she's going to require obviously the additional adult support during activities that require any transportation, which will be shown in the BIP that we have set up for Tessa.
The additional bus support is to help Tessa deal with the over-anxiety or overstimulation of the larger crowds, the noise. With her past and her anxiety level, we felt like that it would be important to have just backup support adult there in case the sensitivity to the overcrowdingness got to her and her behavior started to rise or impact the safety of others as well as herself on the bus.
With Tessa completing the Alabama High School diploma, basically she'll be taking math, English, science, social studies, reading, and then 2 electives. For the goal that we have set for Tessa, it says that basically for post-secondary education, we will have Tessa being prepared to participate in a technical and non-degree program based on her completion of her IEP, her high school diploma program, and then the submission of an application or enrollment. Would you have any issues with us as a school focusing on a technical and or non-degree education, which basically means that she would be getting a certificate? It's very comparable. It's like going to a technical college is basically what it would be for Tessa. For her employment, we have that she will be prepared to engage in a career-related planning leading to the selection of a career based on her interests, aptitudes, and any occupational information. For her community and independent living goal, we have that she will participate in community activities and will live independently based on the independent living skills that she has achieved and the identification of any community living options that she has. Basically, would you have any issues with Tessa living independently on her own or with a significant other or maybe even a friend just to see where she's going as a girl once she has graduated college? Or not college, I'm sorry, high school.
Yes, I would like her to get a job and take on some sort of responsibility during the summer.
We're actually going to skip ahead to the transition goal that we have set up for Tessa. Basically, it says that she doesn't as of know right now what she wants to do as a career, but she will be taking a career exploration class and to determine her interests. Her annual goal basically states that she will be she'll complete a series of activities in order to prepare her for a transition into a competitive, supportive employment by the end of the school year of this year. Her benchmarks basically state that she'll be able to identify interests and abilities related to potential careers. She'll be able to identify attitudes and behaviors that are necessary for jobs, and that she'll be able to show and demonstrate positive work habits and attitudes on school and in community-based training that we will have possibly set up for Tessa.
I think Tessa is capable of receiving a traditional diploma, but considering everything that's happened, it may be best to pursue a certificate.
Basically, for her math goal, it shows that she's basically ranked in the average percentile, that she's quiet, but she doesn't participate verbally in classes, and then she'll often copy her classmates' assignments. Her annual goal that her teacher had is that she will be able to accept personal responsibility by completing 90% of her math assignments in order to pass her math requirements for her graduation. The benchmarks that we have set up for Tessa are that in the first 9 weeks, she'll be able to complete 25% of her math homeworks assigned. By the end of the second 9 weeks, Tessa will be able to have completed 50% of her assigned homeworks. And then by the end of the third 9 weeks, she will be able to have completed 75% of her homework assignments. But again, obviously, we expect Tessa to complete at least 90% of her assignments.
I don't have any concerns at this time with our math goals. Let's just see how it goes throughout the year, and we'll talk about it again at the next IEP meeting.
As you see written by our math goal, that we're not as worried about Tessa and the content area because she's able to learn the math. It's the compliance of actually doing the math. So really, although this is a math goal, it's actually revolved around a behavior goal with compliance, because we need to work on these life skills because she's not going to be able to get a job if she cannot comply with what's expected of her. So this all ties into her behavior and transition goals for the workforce. So this is important that she master this goal and use good responsibility. We're learning those skills, being compliant, or at least attempting to be compliant.
The next part we basically will be talking is about Tessa's English. It says right now she's struggling to use capitalization, punctuation, and sentence structure in her independent writing, that she is able to identify mistakes that is presented by the teacher, but she struggles to identify her own. Her annual goal is basically that she will understand and demonstrate the knowledge of English during written assignments, tests, and quizzes in 3 out of 4 attempts. Her benchmarks that we have listed down here is that she will basically demonstrate an understanding of capitalization with 75% accuracy. She'll be able to demonstrate punctuation, comma, semicolons, and things like that with 75% accuracy by the end of the school year. Subject-verb agreement, she'll need to be able to understand, and then spelling, which we don't think is a serious issue, but it's an issue that we feel like she needs to accomplish more in.
No, I do not mind. I want to do whatever I need to do to make sure that she improves on her English. Her math and English goals look really good to me, so I don't have any questions at this time.
I'm actually going to skip over the behavior management goal that we have set up until Miss Root is actually able to explain Tessa's BIP, which would summarize a whole bunch of everything else in her behavior management plan. Basically, we're going to go on to the services that we're going to provide for Tessa. She'll be having a behavior intervention social skills group daily, every day. She will also be having guidance counseling and behavior weekly and twice a week, just to make sure that she's able to adjust to her settings and everything like that. And basically, we just need to know if you're going to be comfortable with her having guidance counseling and behavior counseling as much twice a week and then once a week, just to make sure that she is all right emotionally and physically.
Yes, I sought counseling for her once before, so I think it would be very beneficial for Tessa. No, not at all. I want Tessa to be as independent as possible.
For Tessa's supplemental aids and services, basically we're going to allow Tessa to have additional time to complete her assignments, and that will even allow her to have alternate assignments throughout the day in her classroom. Her program modifications, we basically, all of her academics will be presented in a variety of ways, just to make sure she's understanding all of the information given, and so we're able to record her growth and see where she's building and where she's lacking. We will also be using prompts and redirections to aid any on-task behaviors, just to make sure that Tessa is able to function as well. We are going to allow her to retake any of her failed tests and average the scores together. And then she will also be allowed to have extended time on her tests as well in each of her classes. For support for the personnel, we're basically planning on training all of our personnel who are responsible for Tessa's behavior intervention plan, just to train them weekly as to how to use a token economy basis. We will also be training the personnel that are responsible for her behavior counseling in working with sexually abused children. We're going to do that training once a year, just for all of her special education teachers and everything like that. We are actually going to be talking about her BIP and her behavior management plan right now, and then once we're done, we will get to signing all of the signature pages.
The first thing I want to go over when discussing Tessa's behavior intervention plan is I want to go over the importance of understanding why Tessa has these behaviors. It's extremely important that her team realizes what she's been through, and like 9 out of 10 other kids with behavior problems, when these outbursts occur or shutdowns occur, they're usually caused by the lack of communication skills or the lack of ability to express their feelings. So I want to make sure that when we are going over Tessa's behaviors, that we are understanding of the behaviors, and that we realize that these are not always helped, and that she is going to have to learn coping skills to deal with these behaviors. We've gone over Tessa's present level of performance throughout the entire IEP, and as you saw in each academic goal, the underlying issue was behavior. Compliance, shutting down, not wanting to work with groups during group projects, and I know that a lot of their high school classes involve working with a group because that's what's preparing them for the workforce. So a lot of our skills are going to revolve around how to communicate with others and to keep our anxiety levels down while still getting the job done. I'm not going to go over every single behavior that we're seeing with Tessa. I know that as her team, we're all very aware of them. I've sent home the behavior intervention plan in advance, so Miss Troubled, you've been able to review it, and if you have any questions, you can stop and ask at any time. The cause of the way her behaviors are affecting her academics are because of her withdrawn attentiveness and her negative outbursts towards academics, her shutdown, and they've all caused her grades to drop dramatically, which has been in direct evidence of her recent report cards.
No, there are no new concerns since last time we spoke.
Due to the severity level of Tessa's behaviors and the frequency, we have classified her behaviors as extreme. Therefore, as the team felt that it would be important to perform a functional behavior assessment or an FBA, which is all wrapped up into this one behavior plan. After taking in consideration all of Tessa's behavior infractions, all of her teacher input and teacher observation, we compiled all of the information and came up with the goal of Tessa will increase her ability to function successfully in the classroom environment, as evidenced with her compliance with classroom and school rules through application of learned and applied behavior strategies in 7 out of 10 observed opportunities, to do so for 5 consecutive days with no more than 1 office referral. So we'll break that down into, we won't expect that in the very first 9 weeks. In the very first 9 weeks we may do 4 office referrals and then break it down to 3 office referrals, and then by May of 2014 we're looking for no more than 1 office referral. Some of the strategies and replacement behaviors that we've been teaching Tessa are to ask for a break, or to get the directions again, ask what exactly am I supposed to be doing? I missed that part. What's next? If she's prepared for the transition, that helps a lot with our students with behavior issues. It's just that opportunity to prepare themselves and their anxiety levels for that transition. Some other replacement behaviors that we are working on with Tessa are asking for assistance when needed, expressing distress when in a socially acceptable manner, not screaming and hollering or just laying your head down on the desk and refusing to do anything, but actually something that will not make her stick out as much. Our goal is for her to be as typical as possible in the general ed setting. Also, we want her to independently prevent those inappropriate behaviors. Like Ms. Baker had mentioned prior in this meeting, we are going to put in a token economy system as a reward system. A lot of people think this is a sticker chart. It can be anything. You can turn a token economy into it just be a check mark on her paper that she realized she's got a visual realization that somebody's caught her doing what she's supposed to do. And just that visual reinforcement, it could be giving her additional time in one of the activities during the day that she likes. It's not, a lot of people think of it as elementary, but it can be addressed in a high school setting as well.
So after hearing all of the information, basically what we need to do right now is have everybody sign the IEP, just basically explaining that we have accepted the IEP that we've developed and the BIP that we've developed for Tessa this year. We have discussed any IEP for extended year services. I plan to provide you with a copy of Tessa's IEP at the end of this meeting. And then I'm also going to give you the special education rights that we have to give all of our parents at the end of this meeting as well. But pretty much that is the end of the meeting, and I think we've said everything. So if you have any concerns or anything like that, please feel free to give us a call at the school. We don't have any issues with getting in contact with anybody. Hope you all have a wonderful day.